I'd like to go over this article that was published in the JCRS in September of 2021. It talks about flange erosion, exposure, and the risk of endophthalmitis. And this is in reference to the Umani technique, but also in regards to the Canabrava technique. Now, the incidence of endophthalmitis with these specific techniques is low, but certainly possible. And what this article highlights is that this risk of endophthalmitis is not just short-term, but also long-term. It describes a case of endophthalmitis many months after surgery. So just like with trabeculectomies, where they can get endophthalmitis many months later, unfortunately with these techniques or any flange technique, you have to basically monitor the patient for these rare, although serious effects nonetheless. Now, what I wanted to show you is some of the common suturing techniques or fixation techniques, and how one of them somewhat stands out in regards to endophthalmitis risk. So here is basically a scleral fixated lens, and it's using, in this case, Gore-Tex suture. Now, Gore-Tex suture, like with flange techniques, it can also potentially erode through the conjunctiva, and if it erodes through the conjunctiva, that could be a potential tract for endophthalmitis. So sclerally fixated IOLs with Gore-Tex are also theoretically at risk of endophthalmitis, and that risk is lifetime because we never know what's going to happen to the Gore-Tex and whether it's going to erode through the conjunctiva. This is the classic Umani technique with the two flanges, and of course these would be buried deep. I'm just pointing them out for illustration. And then if you're using the Canabrava technique for something like an acreose, then you're going to have to use 4 flanges. Now, obviously, the more flanges you use, the higher the risk of endophthalmitis because you've got 4 tracts, and also the higher the risk that one of them may erode through the conjunctiva. So theoretically, a procedure with less flanges would be ideal. And now the one thing I want to highlight is, so this can erode with time. This can erode with time. And the one risk we do want to avoid in all of these complicated cases is endophthalmitis, because often that can be very difficult to fix and the prognosis is guarded. With this technique, I'm highlighting iris suture fixation. The unique thing about this technique, unlike all these techniques, is the knots or the fixation points are actually inside the eye. So you will never have any of these knots erode out through the sclera because the fixation is inside the eye, it's in the iris. And so the one nice thing about this technique is you know that you will not have to worry about long-term or potential long-term risk of endophthalmitis. Now, of course, all these techniques are susceptible to UGG syndrome. There is not one technique here that has a higher rate of UGG syndrome compared to other techniques. But the one thing I wanted to highlight is the unique thing about iris suture fixation, in that you don't have this risk of exposure down the road. Now, I do all these techniques, and I do not think that one technique is superior to another, but we also want to think short-term and long-term in terms of the techniques. This is just some illustrations. This is a case I've done a while back, and again here I've buried the Gore-Tex suture, so the knot is on the other side. So again, the risk of exposure is low, but nonetheless, it is a possibility. And here's an example of a case I did recently of iris suture fixation. You can see again the knots are actually inside the eye. But again, to summarize, all these techniques are great. We just have to think short-term and long-term. And I hope you found this video to be useful.